My desire to really educate people came as I started practicing medicine. Because people, doctor means in Latin to teach. And I always tell people, a doctor cares, but nature cures. And so when I see patients, you really have to really do a very in-depth interview with your patients, and you have to really know your patient. There's an old saying that Hippocrates says, it's better to know the patient that has the disease than the disease of the patient. Because you treat patients, you don't treat diseases. Because let's just say, hypothetically, someone comes in and they have breast cancer. Well, the next 10 people that you see have breast cancer, they don't have the same disease. Or the same person who has hypertension, or the same person who has diabetes. All of these diseases are going to be treated differently. Are there some common recommendations? Yes. But you also have to really understand the stress of that patient. How is that patient sleeping? How are they biochemically detoxing? What are their activity levels? What is their stress level? All these other factors that play a part. And unfortunately, in medicine today, doctors just go in, hi, how are you? What are you here for today? Oh, you have a headache? Okay, I hear I have this great drug. See you later. Bye. Well, okay, that does not help the patient. That doesn't help really the doctor. It doesn't help the relationship. And so medicine has really gotten away with the cultivation of a relationship. A doctor-patient relationship is a partnership, because I tell my patients, you're only going to achieve whatever I recommend that you do. So you're only as good as the recommendations that you take heed to and really follow. Because I can't go home with you. I can only sit down and discuss, and this is what I think, but at the end of it, you're the one that's going to have to carry out these recommendations. I always tell patients, health is a process, not an event. And progress is a process. It's not one day there's this magical cure. Now, granted, if you came in with a strep throat, I could say, okay, you know what, I'm going to give you this antibiotic because this is really the best thing for you, and you're going to be better within 24 or 48 hours. But for most chronic illnesses, you need to make very significant other changes that take time to implement. And they take commitment and they take dedication on your part. And they also take dedication and commitment on my part. I've got to learn and understand what's going to be the best way to take care of you. Because like I said, every individual is an original.